Good afternoon. It's great to be here. My name is Dr. Tolulope Alugo from St. John Cap. At St. John Cap, we help parents, especially parents who have a child with a mental health diagnosis, to parent their child more effectively. And we do this by providing mental health education information on different social media platforms, in-person trainings, and workshops. Today, we're departing a little bit from youth mental health education to talking about physical health, particularly in women of African origin who are living outside of their home country. So I've got a special guest with me. I'm just going to add her to the stream while I read her bio. Dr. Ngozi Onuoha is a medical doctor who obtained her medical training in Nigeria, United Kingdom, and the United States. She obtained a Master's of Business Administration in Healthcare Management and has taken certification courses in global health. Dr. Onuoha is a clinician, health educator, and public speaker who provides health awareness content through social media to improve health and well-being. Thank you very much for joining us today. We're grateful that you're taking time on a Sunday to do this. Thanks a million.
Thank you, Dr. Tolu. I'm so excited to be here. Thank you so much for inviting me.
Thank you for coming. So, I'm really excited about the conversation today. Typically, I talk about youth mental health, but it's important to realize that for a child to be, to be well, to be healthy, the parents have to be healthy, not just mentally, but also physically. So, today we're really going to be, talking about women's health, then Black women's health in general, more specifically. So I'm just wondering, are there health challenges that women face when compared to the male counterparts? And do these vary with age? But before you answer, I'm just going to say to anybody who's joining us live, please put your comments, make your comments in the comment section. We'll try and address them and answer a couple of questions before the end of our session today. Go ahead, Dr. Ngozi.
All right, so that's a really great question. As you know, you're an autism specialist, so you know that autism spectrum disorders are very challenging in the family setting. They affect all facets of the family finances, the family socialization, and just the amount of time that is needed to work with the child. So women bear the brunt of these challenges because I hate to say this, but women run the show. In the household, women really run the show. And the reason I say this is because uh, women have their normal job, be it 9 to 5 or shift work, whatever they do outside of the home. And then they come home and they have their second unofficial job, which is providing for the household, the family, providing for their partner, the spouse, the kids, their families. So that's the second unofficial job. And those women who have two jobs outside of the home, then you know that is their third job. So the demands on women are really huge, humongous demands. That those demands do not allow women to find time to take care of their own health needs. So women, you find, they tend to put their own healthcare needs on the back burner, so to speak. So they put themselves last when it comes to health. So, when it comes to women's health, we know there are certain things women should do depending on their age. So, I can go over that. So, depends on how old the woman is. If you have a woman in her 20s to 30s, she's really occupied with her reproductive sexual health, mental well-being. Those are sort of the kind of illnesses that women in that age range typically are concerned with because they're pretty healthy. So a woman in her 20s, she doesn't have a lot of chronic medical concerns typically. So illnesses, they sort of start to kick in towards the late 30s, 40s. So women in their 30s to 40s, they might be concerned with metabolic metabolic health concerns, for instance, like obesity, high blood pressure, diabetes, so those sorts of things. And then women in their 40s, 50s, late 40s to 50s, they start tackling the issue of menopause. And so their concern is around, again, metabolic conditions, as earlier mentioned, and then the issue of menopause. So they're also concerned with their reproductive and sexual health. And then older women, 60s, 70s, then you have start having concerns with memory, concerns with mental health, concerns with also reproductive health, sexual health, things like urinary incontinence, things like mobility concerns. And then in older adults, of course, you have the concerns that are prevalent as people age, which is loss of their independence, loss of mobility, concerns with memory, and also mental health concerns like anxiety, depression, we tend to increase as people get older. And of course, as people get older, there are concerns about cancer. Cancer tends to be more common as people get older. So women who are taking care of a child or children with autism, they really have to look at their health and say, okay, what can I do for myself, and set certain goals. Now, if they're busy with family, taking care of the child, a child with autism is special needs, they need to go to various programs, doctor's appointments, various other training programs, therapy, counseling, and so much. So imagine a woman juggling a job outside of home and has to take her child to all these appointments. They can be quite draining, can cause mental fatigue. So the impact is really huge on women's health.
Wow. It sounds like for a woman, there's just so much burden that a woman carries from, looking after the home, her job, juggling that with family life. And then also if now you don't have to care for a child or a loved one with a chronic physical or mental health illness, it's an added burden. Thank you for that. So I'm wondering about the African American or African population. Are there particular risks that those women have? And again, just to tie in a different question to that, for women who have immigrated to either maybe to the US or Canada or the UK, so they're away from their families, from their country of origin, are there other risks that also brings to their health?
Yeah, that's a great question. Oh, those are great questions, rather. So,
Mhm.
in terms of African American women or women of color, uh, they have very huge health disparities. And there are many factors that have contributed to the health disparities. So, health disparities meaning differences in health outcomes. They tend to have worse health outcomes. And there are many factors for this. Number one, economic and social factors. Ability to get good jobs that have good benefits, lack of health insurance, and sometimes the educational level, just having the know how, being able to identify, oh, there's a health need and I need to seek support. But the socio-economic impact is very huge. Unless a woman has access to a good job. So good job meaning good pay, a good job meaning she has good health insurance, and a good job meaning she's able to facilitate time away from work to access care. So when you look at the populations that are adversely impacted, say for instance the populations of people of color, and they are doing mostly the blue collar jobs. They work in the factories. Some of these jobs don't have benefits. They don't have insurance. They can't take time off. The factory is open 9 to 5, and when they get home, the doctor's offices are closed. Those
Mm.
women cannot navigate their health care. They cannot make appointments. The hospital is closed. They can't get mammograms. The mammogram facility closed at 2 o'clock. They can't get in. They can't schedule their physician appointments because they're busy working, and that job does not allow them the time off. They don't have vacations. So there's just so many factors that impact people of color. Now, when you look at immigrants coming into, say, for instance, Canada, America, the UK, other developed countries, they're coming in from settings where they don't have consistent access to care. So they're not used to going for their health checks. It's not the norm. Medicine in some of the developing countries is more reactive as opposed to proactive. So, what I mean by that is people wait for things to go wrong before they seek care. So that culture of going for checkups before they have a problem is not really the norm. So when they come into these settings, they don't know how to navigate some of their benefits. They have health insurance. They don't know that a pap smear, mammogram, and some of the screening tests and vaccines are part of the normal health maintenance. It is not normal for them because they don't know about these services. So they have problems navigating the healthcare system. It may be problems because they have language barriers, or they don't know where to go to seek the care they need. In addition to so many things, coming into different community, not knowing where the community support is, and also the stigma of seeking health care. Some people don't want to go to doctors because they're afraid to be diagnosed with certain conditions. There's a lot of stigma when it comes to certain medical illnesses. So that I'll tie in the lack of education, the lack of exposure. If women are not taught about pap smear, and you start telling them about pap smear, but they did not learn about pap smear when they were in, say, for instance, Africa. They don't know what you're talking about. So they think you want to
Mhm.
stir up trouble, and they don't know that a pap smear is necessary. It's a life-saving procedure to identify cervical cancer at its early stage. So when it comes to immigrant health, they have even worse health disparities than African Americans, for instance, in America. So I hope that answers your questions.
It really does, and it resonates so much with me. Being obviously from of African origin. I remember when I first moved to a developed country, and I was a junior doctor. They thought of having to take time off work to go and see the doctor for when I had nothing wrong with me. I was, acute, was something I would always postpone and think, "Ah, I'm well. I don't have to go and do a mammogram. I don't have to go and do a pap smear. How would I tell my boss I need to take time off?" So for immigrants trying to get on that job ladder, trying to, increase their credibility at work, it's difficult to be asking for time off. And again, the understanding, knowing where things are, what should be scheduled, at particular times, accessing services, all those things are information that, Black women who are moving out of their country or who are, even native to the US or to Canada need to have. And then the health disparities, that is so key, because I think, we have to keep advocating for people to have access to services. And it's even worse in the US, where there is issue of insurance. Canada, we have it a bit better because healthcare is socialized and free for everybody. But I can see where those challenges would be a barrier. So I mean, we've spoken about risks in women of color, women who are immigrants, women who care for a child with a chronic health problem. So I'm just wondering now, how can we mitigate these risks? Are there any prevention strategies, early intervention, early detection strategies, and any recommended health screening that you would talk to us about today?
Okay, so to mitigate some of these factors, I think you could really tackle this on various levels. You can tackle it at a community level. So, addressing some of the sort of pushback when it comes to accessing the normal health screenings that people should have. So, from the community level, really women groups having discussions about what needs to be done at certain ages. So there's a lot of information everywhere. I have some information on healthforniger.com/wellness. There's a Well Women's checklist, and women can download this checklist. And with that, they will be able to understand what they need to get done when. Um, Generally, once an adult once a person becomes an adult, they should make it a habit of going in once a year just for a regular checkup. And I always use the analogy of a vehicle. If you have a car, to be roadworthy, you have to have inspection every year. So I always say to people, once you're 18, at least make it a habit to go in and get a once a year physical. Now, specifically to women, what can they do? I talked about the community groups, and those community groups can be formal or informal groups. So the informal groups can be support groups, so support groups, women groups on Facebook, or even some women's group on I'm sure everyone belongs to some women's group on WhatsApp. So there are so many informal groups, even family groups or groups of the sisterhoods, or so I think, and other support systems. So I think it's time for women to shift the conversation a little bit and say, okay, let's talk about pap smear. Why is it important? And last week, there was an article that came out. It was basically looking at white American women in the South of America. And apparently, there's an increase in advanced stage cervical cancer in a particular group of women between 30 and 35 or so. And that's because the women missed their pap smears in their 20s. So pap smear typically starts around 21, and then it goes on till 65. Mammograms typically start at age 40 and every year and goes up till 70s, but pretty much depends on the woman's, deciding to stop the mammogram depends on the woman's overall health and her preferences. And the third screen is colon cancer screen. And this is really recommended from the age of 45. And there are so many options for getting colon cancer screen, not just the colonoscopy. There's the stool test, and there's the CAT scan and barium enemas, although the colonoscopy is the gold standard. So the three main health screenings that women need to be concerned that prevent cancer. Well, it detects early cancer. And as we know, when you find something in its early stage, it's often much easier to treat than having to deal with cancer that has spread all over the body. So the whole idea of the screenings is really to identify diseases, cancer before cancer spreads. Now, there are certain other screenings that occur depending on the age of the woman. So women in the 20s, 30s, they want to get screened for sexually transmitted infections. This is a pretty easy test. It's done through the urine. Women in their 30s, 40s, they want to get blood pressure checked. They want to be checked for cholesterol, checked for blood glucose. Now, there's a lot that has happened in the last few years. You can actually, women who don't have access to insurance, if they don't have access to free health care in their community, they can actually go online and book these tests, pay cash, go into the lab and get these tests done. So a couple of the labs have this service. They can just go into the lab. And also, very important for women, if they're so busy, they can't get to the doctor to do their pap smear, there's a test they can do, which is the HPV test. It detects for the human papilloma virus. We know the human papilloma virus is a precursor for cervical cancer. So people with human papilloma virus, majority of people will clear it spontaneously. But for those women who don't clear this virus spontaneously, it can go on to cervical cancer. So the HPV test is also available. This is all online. Just Google it, HPV test. You pay. The kit is sent to you at home. You swab and you send it off. And if the test is negative, just repeat it the following year. If you have HPV, then you know you need to definitely schedule an appointment with your GYN doctor. So I think basically staying engaged is very important. Understanding what you need to do when, and at least taking time off, maybe once a year, to say, okay, I'm going to schedule my GYN visit this year. I'm going to schedule my mammogram. And it may be you have to take a day off. You see, I don't just blame women. I also blame employers because they're not giving the women the time to access health services. Let me give you, for example, colonoscopy test needs 2 days off because one day you're doing the prep and the next day you're doing the actual procedure. So, and if women don't have the time off, they need to factor it in their calendars and maybe take a vacation day or try to look at the days that are public holidays and take that day off and the next day if they're going to have a colonoscopy so they have adequate time to prep. But definitely it does need a little bit of effort to plan. You can't just get up and say, oh, I want to go to the doctors. If you are so busy, you just don't have the time. So it really needs a little bit of effort. And like I mentioned earlier, it's now possible to book some of these tests online. Some of the local labs do have packages that you can pay for cash. And after you get the test done, if there are abnormalities, then their doctor will call you and tell you, okay, listen, blood sugar is high, you need to go see a doctor, or your cholesterol is high, you need to make some changes. And there's so many things. I think women who have insurance, they have access to benefits which they're not aware of. For instance, they have access to exercise classes, access to the gym, they have access to nutrition support, access to therapists or counselors, which they may not be aware of the full insurance package. Imagine you have great insurance, but you're so busy you can't even use this insurance. So that is another limitation of access to care.
Wow, those are such great nuggets. Even I have to go back and listen to this video again and begin to think of the things I need to schedule. So if you're living in Canada, for example, where you don't need to pay for anything, but you just remember to go to your family physician to say, I need you to book me for a mammogram or a colonoscopy or an H, whatever it is, once you can go with a checklist and ask your family physician, because if you don't go to the appointment, if your family physician assumes you're fine, so they're not going to be chasing you. So it's important, particularly if you're new in the country, to go and find a family physician, introduce yourself, register, and then go for those consultations, make an appointment to go in and discuss the checks that you need to have done. So we're going to wrap up in a couple of minutes, but I'm just wondering, before a woman goes to see her family physician, for example, what is the best way to get, a really good consultation? How do you get the best out of a consultation with your provider? In Canada, I know there's some family physicians that will say it's one problem per visit. I don't know if that's the same in the US. And so you get in there, you're just so nervous because you don't want to be wasting time. Or so what's the best way? What's the best approach to that?
Okay, well, there are two sort of broad categories, I would say, of visits. You have the wellness check. And typically with the wellness check, they it's just a wellness check. It's not really a problem focused visit. Usually most doctors will allow you to have one complaint. I mean, I don't know how you can have one complaint. If you're going there with menopause, you complain of you can't sleep, you have hot flashes, you're irritable. How is that one complaint? But that all comes in under menopause. So I think women can navigate their visit better if they have an idea of what they want out of that visit. So writing it down. What is your goal for that visit? You're going to the doctor's office. What is the main concern that you have? What is the main priority concern that you have? And then center your visit around that main priority concern. And you'll tell the doctor, I have other concerns, but I have this one main concern. So if you have to pick one concern, can you take this concern? But having said that, you may go into the doctor and you may have three concerns, and the concern you think is most important to you, when the doctor sees it, it will say, oh no, this is not a major concern. You're having chest pain. So we're going to address the chest pain today. But definitely having a list, it helps you be prepared. Um, Taking along a list of your medications or your actual medication bottles, if you take medications, it helps. And then if you have a list, if you're new to that particular provider or doctor or nurse, if you have a list of your previous records or previous tests that you've had, it really helps to move the visit along. But I think just having in mind what is the main concern and what do you hope to achieve from that visit. You may have something in mind. For instance, you're going to the doctor's office. You need a mammogram prescription because you want to get a mammogram. So you know you must not leave that place without your mammogram prescription. Or you may want a vaccine. You may be planning travel and you need malaria medications to take, anti-malarials. So you got to write it down to know, okay, when I get there, because you may get there and you forget and you leave out. Now, if the doctor cannot tackle all the concerns in that one visit, then the thing to do is to schedule you for an appointment. And I think now with a follow-up appointment, I think now with virtual visits and with telehealth, I think that should be so much easier to navigate, to be honest. Before the pandemic, a lot of practices did not embrace telehealth, but now telehealth has become the norm. You have video visits. Even if you don't have access to video visits, you have audio visits. So there's really no excuse not to seek care and put ourselves forward. If a woman takes care of an child with autism, she needs to consider that she needs to be healthy to take care of that child. If something happens to her and that child is left, to who knows what. So women really need to prioritize themselves and say, okay, at least once a year, I'll go in, I'll go get a checkup, I'll get my blood test. So this should really be the standard, especially as women start to get into their 30s. And, mid 30s is when things like blood pressure, diabetes, all those conditions start to kick in. And we talked about cancer risk being higher as people get older. But for someone in her 20s, a lady in her 20s, she doesn't have to go in every year for checkups. People in their 20s tend to be pretty healthy for the most part. But the most important thing for them might be their reproductive and sexual health. So, those needs have to be addressed. And I think it's really prioritizing their needs. And it can be very difficult. I can speak to my own health challenges and how at the beginning of the year, I wrote down that I needed to see certain specialists. And when I looked down at this, my list, knowing I was coming to talk to you, and out of the 5 items on there, I've managed to accomplish 4 of them. And the fifth one was not any fault of mine, really, that I haven't been able to see that specialist, because when you call for an appointment, they'll give you 6 months appointment of 6 months,
Wow.
or they'll tell you the doctor's schedule is not open, or the doctor is on sabbatical, and then you move on to other things and then you forget about that appointment. So really, I think writing down a list of key health areas that you need, and it can just be 1 or 2 things a year: going to your GYN and going to your primary care visit, making sure you get your blood work, making sure you're on top of your vaccines, you've gotten your COVID vaccine, your flu shot, your pneumonia vaccine, all the vaccines that you need to get. This is extremely important.
Fantastic. Thank you for these tips. These are really great tips. And of course, I mean, the basic things like eating healthy, like exercising, checking your eyes, are also things that we may want to add to the mix. So where can we find you? If we wanted to follow you on social media, what are your social media platforms?
Okay, so my brand is Health for Niger. I spent my formative years in Nigeria, so I'm very much into my Nigerian roots. You can see my lovely Ankara jacket here.
It's beautiful.
Thank you. So my brand is Health for Niger, and I provide health education on social media. And you can find me on all the platforms. You can find me on Twitter, on Instagram, Facebook, the whole Pinterest, LinkedIn. Even podcast as well. We're there.
That's fantastic. So you guys go follow Health for Niger on whatever platform catches your fancy. And remember, St. John Cap also, we are here. We provide healthcare information, youth mental health information on Instagram, on Facebook, on YouTube, on Pinterest, which I joined because of Dr. Ngozi telling me about it actually. So there's a lot of information. If you have a child on the autism spectrum, you live in Canada and you're of African origin, there's a Facebook group that you can join called Parenting Diversity in Diaspora. So if you just check on my Instagram page, there's a link to join that as well as an online course for preteens who are 9 to 12 years old to develop emotional health awareness. So there's a lot of information out there for your mental health, for your physical health, and it's just important to, chase that information down and get what you need. So before I let you go, Dr. Ngozi, do you have any last words for us? Any final advice?
Well, I encourage people to have health dialogues with one another. Sometimes you call a friend and you chit chat about hairstyle and the tailor and the and the gele. I think
Hmm.
I encourage people to discuss health matters because when you discuss health matters with your friends, your family, they'll keep you accountable. They'll check on you. How was your mammogram? If you're going for a mammogram, you tell a friend, "I'm going for my mammogram next week." So that way you have someone to connect with, and it keeps you accountable.
Great, that's fantastic advice. And it also normalizes health seeking. It's normal for you to get help, not until there's something wrong, that's going on. So that's
Mhm.
that's fantastic. Thank you so much for joining us this Sunday. It's a Sunday. I really appreciate you taking the time, and hopefully we can chat again soon. If you're a man watching this broadcast and you're thinking, why wouldn't they talk about men's health? If you comment, if you are catching a replay, just say hashtag replay, leave a comment saying talk about men's health, and we will do so once there's enough interest. Thank you very much, Dr. Ngozi. Thank you, everyone.
Thank you, Dr. Tolu. Thank you, everyone. Bye.